Welcome. I am Dr. Lori Erickson, one of the Associate Editors of Mayo Clinic Proceedings. In this recording, I will focus on the articles that our Editor-in-Chief, Dr. William Lanier, has chosen to feature on the cover of the October 2013 print journal. Featured in this month's issue of Mayo Clinic Proceedings is the article, Endovascular Therapy for Acute Ischemic Stroke, a Systematic Review and Meta-Analysis, by Dr. Singh and colleagues from Mayo Clinic, Rochester, Minnesota. They retrieved 1,252 articles, 5 randomized trials enrolling 11,097 patients with acute ischemic stroke, of which 711 received endovascular therapy and 686 received intravenous tissue plasminogen activator. They found no significant improvement in outcomes in patients who received endovascular therapy compared to those who received intravenous thrombolysis. However, among patients with severe strokes, endovascular therapy was associated with improved outcome, but the sample size was small in this subgroup. In the accompanying editorial, The Quest to Prove Endovascular Stroke Therapy, Searching for the Sweet Spot in Patient Selection, by Dr. Liebenskind from the UCLA Stroke Center, and Dr. Kucheria from the University of Pennsylvania discuss the article and provide insightful perspective. The next set of featured articles address medical decision-making, evidence versus reasonable belief, with an accompanying editorial, Empiricism and Rationalism in Medicine. Can two competing philosophies coexist to improve the quality of medical care? By Drs. Lanier and Raj Kumar from Mayo Clinic, Rochester, Minnesota. The editorial discusses the article by Dr. Prasad, Why Randomized Controlled Trials Are Needed to Accept New Practices, Two Medical Worldviews, and the article by Dr. Snyderman and colleagues, The Necessity for Clinical Reasoning in the Era of Evidence-Based Medicine, in this month's issue. The next featured article, Association of Coffee Consumption with All-Cause and Cardiovascular Disease Mortality, is by Dr. Liu and colleagues from the University of South Carolina, Columbia, Ochsner Medical Center, New Orleans, and the University of Bath, the United Kingdom. To evaluate the association between coffee consumption and mortality from all causes and from cardiovascular deaths, the authors analyzed data from the Aerobic Center longitudinal study, representing over 43,000 participants with nearly 700,000 person years of follow-up. With a mean follow-up of 17 years, men who drank more than 28 cups of coffee per week had higher all-cause mortality. Younger men and women showed a significant association between high coffee consumption and all-cause mortality after adjusting for potential confounders and fitness level. The authors suggest that it may be appropriate for younger people to avoid heavy coffee consumption, greater than 4 cups per day. Also featured in this issue of Mayo Clinic Proceedings is the article, Improving Affordability Through Innovation in the Surgical Treatment of Mitral Valve Disease, by Dr. Suri and colleagues from Mayo Clinic, Rochester, Minnesota. The authors compared 185 propensity-matched patient pairs undergoing isolated conventional open versus robotic mitral valve repair with identical techniques and care teams from 2 time periods, before and after the implementation of system innovations. With the introduction of systems innovation, the total hospital cost associated with robotic mitral valve repair became similar to that for conventional open approach, while facilitating quicker patient recovery and diminished utilization of in-hospital resources. They conclude that innovations in techniques such as robotics, along with process improvement care systems, can be cost neutral and improve affordability of new technologies to improve early outcomes. The original article entitled Proton Pump Inhibitors and the Risk for Hospital-Acquired Clostridium difficile Infection is by Dr. Barletta and colleagues from Midwestern University College of Pharmacy, Banner Estrella Medical Center, and Banner Thunderbird Medical Center, Glendale, Arizona. They conducted a retrospective case control study of adult patients who developed nosocomial Clostridium difficile infections, matched with hospitalized patients who did not develop these infections, in a 1:2 ratio. They compared multiple factors by multivariate analysis and found proton pump inhibitor duration to be a risk for Clostridium difficile infection. The review entitled Etiology and Therapeutic Approach to Elevated Lactate Level was authored by Mr. Lars Andersen, Aarhus University Hospital, Denmark, and Beth Israel Deaconess Medical Center in Boston, Massachusetts, and colleagues from Beth Israel Deaconess Medical Center in Boston, Massachusetts. This review addresses the conditions that can cause elevated lactate, the association of elevated lactate with increased mortality in certain diseases, the association of decreased lactate clearance with increased mortality in certain conditions, and the use of lactate clearance as an endpoint in resuscitation. The review, entitled Chronic Cough, an Update, is authored by Drs. Iyer and Lim from Mayo Clinic, Rochester, Minnesota. The review addresses the definition of chronic cough, causes and assessment, and caveats in the evaluation and treatment of chronic cough. Video interviews are available with authors or co-authors of articles on medical privacy after death, implications of new modifications to the HIPAA privacy rule, endovascular therapy for acute ischemic stroke, a systematic review and meta-analysis, association of coffee consumption with all-cause and cardiovascular disease mortality, the necessity of clinical reasoning in the era of evidence-based medicine, chronic cough, and acupuncture. These interviews can be found on the homepage of Mayo Clinic Proceedings at www.mayoclinicproceedings.org in the lower right-hand corner. Many more videos indexed by journal issues and by themes and freely searchable are available on our YouTube channel at www.youtube.com/Mayo Proceedings. CME is also available with articles on acupuncture and whole organ tissues reconstruction and thoracic regenerative surgery. As you well know by now, you can find on our homepage a number of online features that are not available in the print journal, such as extra residence clinic articles, medical images, stamp vignettes, and other materials. This month's featured editorial board member is Dr. Richard Goldberg. Also, please follow us on Twitter at www.twitter.com/Mayo Proceedings to learn about online first publications in Mayo Clinic Proceedings and newsworthy developments related to our journal. Please like us on Facebook. Dr. William Lanier, Editor-in-Chief of Mayo Clinic Proceedings, the entire editorial board, and I sincerely hope that you will enjoy these and other outstanding articles in the October 2013 issue of our journal. We are sincerely grateful for your interest in and continued loyalty to Mayo Clinic Proceedings.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.